Today we are going to discuss MCQ number 207 that we put up a couple of days ago on our Telegram channel. It goes like this. It says a 45-year-old female patient came with hip flexion contracture. So it's very important what they're trying to say. Hip flexion contracture. Which among the following tests should be done to identify the problem? So the correct answer to the question is Thomas test, because any hip flexion contracture is seen or suspected, you must do the Thomas test to identify the hip flexion contracture. So let's go through these tests one by one. What is Alice test, what is Thomas test, what is Oberst test, and what is Trendelenburg test? Each of them are very important, have been asked very frequently in your exams, and you must know this very well. So Thomas test is basically to uncover the flexion deformity of the hip. So a lot of these patients mask their hip flexion deformity by lumbar lordosis. So excessive lumbar lordosis helps in the correction of flexion deformity, makes the hip straight because the patient is compensating it with a lordotic lumbar spine. So how do you do it? Make the patient lie in a hard surface and put a hand underneath one of the hands underneath the lumbar spine. Then ask the patient to flex the normal hip. So the normal hip should be flexed. So you flex up to the point that the lumbar spine touches your hand. That indicates that the lumbar lordosis has been corrected. Then you look at the abnormal hip and see how much of the angle it is causing against the cot. And that is your hip flexion contracture. This is your hip flexion contracture. So this is called as Thomas test. Thomas test is basically done to uncover the hip flexion contracture. Hip flexion contracture is compensated by lumbar lordosis. You make the patient lie down in a flat surface. You pass one hand under the lumbar lordosis and ask the patient to flex the normal hip and hold with the hand. So unless ask him to continue flexing until the lumbar lordosis is obliterated. Then you check for the angle on the opposite or the abnormal hip against the cot, and that is your hip flexion contracture. So this is Thomas test, must be done in every hip examination case and is very frequently asked in your NEET and MCQ based exams as well. The second name test that we were talking about in the question was Alice test. What is Alice test? Alice test is basically done in congenital hip dislocation cases. In congenital hip dislocation or DDH or developmental dysplasia of the hip causes dislocation of the hip out of the socket posterior superiorly, and therefore the femoral segment will appear shorter as compared to the opposite side. How do you test this? You make the patient lie down and flex both the knees to 90 degrees and compare keep a scale and compare how much of shortage is there on the affected side. This will indicate a dislocated or a congenital dislocation of the hip. It can be done in adults as well, but primarily done in children to diagnose developmental dysplasia of the hip. So this is called as Alice test to check for the femoral segment shortening, which is very common in DDH. The third name test that was described is called the Oberst test. Oberst test is to identify tight iliotibial band ITB or tensor fascia lata muscle which runs across the lateral side of the thigh and inserts into the lateral portion of the tibia. So therefore, how do you do this test? You ask the patient to lie down on the side. Then you lift up the distal portion of the leg, then flex the knee to 90 degrees. When you flex the knee to 90 degrees, normally the knee will not rise up. Okay, if the knee starts to rise up automatically when you flex the knee, it indicates that there is a tight tensor fascia lata or iliotibial band. This is called as Oberst test. So what is Oberst test? To test for the tightness of the iliotibial band should be done with the patient lying in the lateral position. You can flex the knee, and once you flex the knee, if the knee raises up from the opposite knee, then it indicates a tight iliotibial band. And the last and very important test, very frequently asked, we will go through this in more detail in another video, but very briefly, is the Trendelenburg sign. Okay, so what is the Trendelenburg sign test? It tests the abductor mechanism of the hip. So what does abductor mechanism have? It has many parts. It has the fulcrum, it has the lever, And then it has the power or the abductor muscles. What are the abductor muscles? It is the gluteus medius is the main abductor. So if there is an affection in the muscles or paralysis of the muscle or gluteus medius is seen like in poliomyelitis, it can cause Trendelenburg positive test. That is the abductor mechanism of the hip is disrupted. The fulcrum or the lever is affected, like a fractured neck of femur or IT fracture or some other problem like osteoarthritis of the hip. These can also disrupt the fulcrum and the lever of the abductor mechanism, and therefore disrupt the abductor mechanism of the hip. So abductor mechanism of the hip is basically maintained by the bony architecture, number one. Two is the abductor muscles like gluteus medius, which is the main abductor muscle. So what do you see in a Trendelenburg sign? When the patient is standing on the normal side, for example, if the left side here is normal and the patient is standing, then either the opposite ASIS will either go up or will remain in the same level as this normal side or the side in which the patient is standing. Of course, if the affected patient stands on the affected side, let us say this left side is affected, the sound side sinks, that is a normal side sinks, because the abductor mechanism here is not able to bring the pelvis back to its normal level. So if the abductor mechanism does not work properly, the sound side sinks, SSS, that is the normal side sinks down. So when the patient stands on the abnormal leg, the patient is unable to lift up or correct the pelvis, because the abductor muscles on the affected side or abductor mechanism is affected, and because of which the patient allows the sound side to sink, and this is called as the Trendelenburg positive test. So there is this Trendelenburg test tests the abductor mechanism of the hip. The abductor mechanism involves the muscles and the bony architecture as well. So a fractured neck of femur also can cause abductor muscle weakness. Gluteus medius muscle weakness also can cause abductor muscle mechanism disruption. When the patient is standing on the normal limb, the opposite limb goes up or remains in the same side, because the abductor muscles and the mechanism prevents the pelvis from tilting on the opposite side and maintains the tilt. Of course, if this side is affected, that is then the abductor mechanism is unable to lift up or correct the pelvis, and therefore the sound side sags down, and this is called as a positive Trendelenburg test, SSS, that is sound side sinks. So this is a very important concept. Maybe you should replay this a couple of times and then try and understand this, so that you don't make any mistakes in your exams. This is a very common question both in your practical exam as well as in the entrance exam. So that is in very brief about the question on Thomas test, and I hope you have understood very well. Thank you very much. My name is Dr. Kanan Kumar, and this is Plexus Ortho.